Thank you so much for joining us here at Abu Dhabi Global Healthcare Week.
Thank you.
In your mind, why the UAE? Because there's been so much conversation about opportunities for investment, but at the same time, being able to reach the global south and perhaps providing them more equitable platform for health globally.
If you're looking at my field, which is health and longevity medicine, it was predominantly really focused on the US. A couple of 5 years ago, it really went to Europe, and now it reached Asia. And then there was, I would say 3 to 5 years ago, there was this, the UAE. They also now invest in health and longevity medicine. And the UAE was popping up. And now we are here at this stage, really showcasing that it's not only the industry, but also the governments.
Absolutely.
Who really want to drive the field.
No doubt. AI, of course, they're at the forefront of investment in AI. They've committed something like 100 billion.
Yeah.
To your mind, how does AI change the game when it comes to longevity?
AI is just a tool, and I think it's a fantastic tool. How to use it in my field, health and longevity medicine, we have to see. Very importantly is that we can understand data better. If I talk about data, I talk about the genome, the epigenome, the microbiome, cognitive data, lung data. We have a beautiful body and we have to understand it in a systems biology approach. And there, machine learning and AI kicks really in, because no brain of a physician will understand how our body really functions. So we need algorithms to understand it better. And their AI really kicks in to make use in a very individualized way the data of one individual.
There's a lot of speculation about AI and technology and how that's going to impact us going forward in terms of the aging process, in terms of longevity. What does that look like to you?
My aim is to increase the health span of individuals. And the health span is the years you have on Earth with appropriate health, not having age-related diseases. So when you don't have age-related diseases, then also very often you have the ability to have a good quality of life. So it's really to increase the health span, not so much the lifespan. The lifespan is already increasing because of conventional medicine, which is great. But the health span, there's a huge gap. So 10 to roughly 30 years of life we have with age-related diseases. And how can we close that gap to enable us to have a purposeful life?
How do you see that evolving, particularly in Western societies? How do you encourage people to take better care of themselves? What's the incentive?
There's not so much incentive at this moment in time. I think there's a huge knowledge gap that you can modify your body, that you don't have to have age-related diseases per se, that there are risk factors you could avoid. Health and longevity medicine is focusing on that individual, understanding the genes you are born with, understanding how these genes interact with the environment, and what then on individual level to do to antagonize the aging process.
It's interesting. Over the last couple of years, we've seen the rise of big pharma drugs like Ozempic, for example, allowing some people, particularly women, to have, in some measure, control, if you will, over their body. But what an interesting idea, that being able to understand your individual genome, you can understand what is possible and what is best health for you.
Yeah,
and what that would do to your mental health.
Absolutely. So the genome is the first step, but this is what you are born with. And with the genome and this information in hand, with the book in hand, you can actually say what page in that beautiful book you should read or maybe not to read. So you have it in your own hands, and we understand it now biologically. And how beautiful is it, based on what is written in your book, in your genes, how your environment should shape your genes and what kind of diseases you can avoid just by making choices.
In your mind, what does this do to the future of pharma? Because, as you say, it's going to take a while to shift the narrative from healthcare to preventative, But what does it do, in your mind, to that industry as a whole? Because it's a multi-trillion-dollar industry. They want to evolve with the times, no doubt, because it's good for business. But at the end of the day, how do we make that serve the common good?
I think we are already on the way to bring big pharma in, because if we call aging a disease, It's highly debated because if aging is a disease,
we've all caught it.
We all got it. And we all got it because we see in the mirror that we got it. Yeah. If you're looking at your pictures 10 years ago, you are absolutely looking differently. So we got it. If we can antagonize the aging process with molecules, which we in the end call drugs, and which are approved by the FDA, by the EMA, by the regulatory bodies, that's interesting. It's 100% of the population is aging. 100% of the population is not escaping at this moment in time. I think there is already the evolution to go into the big pharma. We understood in the last 2 decades why we age. That's a fundamental process. We showed in animal models that we can reverse the aging process. Very fundamental. Now we are in the phase to bring it into humans. We are not mice, we are not C. elegans, we are not rats. We have to prove that it also works in humans.
Much more complicated.
The effect size is, then big pharma industries who are already interested, we're already working with them, are even more interested to bring it into clinical practice.
What are some of the big challenges in your mind? Is it a question of morality? Is it a question of data security?
I wouldn't say that data are the problem, also not data security. I think asking the right questions is much more important. I would say in our field, we got the attention. We got the attention because consumers are driving the field at this moment in time. People understand, okay, I am 45, but my biological age is 50. What can I do? So there's the consumer drive. There's the technology drive. We have digital devices where we can now measure our physical functions of our body, which means that it enables us to understand it better. If there is a consumer drive, there are many parties who are jumping into this market. And at the moment, we are talking about a longevity market which is not regulated. Yeah. The term longevity is not coined. Mm-hmm. What do you mean while having interventions to reverse the aging process? Everybody can say, even somebody who is cutting my toenails, I am improving your longevity. So I think that's a problem that it's not regulated yet. Okay. I don't want to push the entire field into much regulation, but at least we need regulation to say, what is a health and longevity medicine clinic? What are drugs to take to antagonize the aging process?
Do you anticipate that this is going to be something much like the pharma industry, which is regulated by different bodies in different countries, or do we need a global approach?
I think first we need a global approach, and that's already initiated with the WHO and United Nations, because we are living in the decade of healthy longevity, of healthy aging it's called. So we are defining already the KPIs within the WHO. I'm advising them to see how we can measure the aging process in different countries. So while having definitions, what is healthy aging? What is geroscience? Can we measure it? But having these fundamental definitions, we can bring it into countries and therewith then also implement it. Yeah. For example, the regulation of who is a physician, who can change your biological age, who is a healthy longevity medicine physician, needs to be regulated. Nobody would go to a surgeon without asking the certificate, are you a surgeon? Because we know a surgeon is a surgeon, was trained to be a surgeon, to have a knife in his hands or her hands.
And beyond that, there are questions of society and the economic costs as well. If people are going to be living longer, they're going to be living more healthier lives. What that does in terms of the burden to the state or to the country or to the world.
Yeah, I think the financial implications could be huge, but these are all assumptions. There are, from David Scott, for example, London Medicine School, there are a huge amount of calculations, but we have to prove it. So how much investment can we do at the forefront to prevent age-related diseases, and then showcasing that the magnitude, that the risk of age-related diseases is also lower. And very likely is that once we have an age-related disease, that we are not reducing so much the cost there, but it's more in the upfront. And this is the discussion ethically at the moment. Who's going to pay for it? Is it the health insurer? Is it yourself?
At the end of the day, that's always the discussion, isn't it? Tell me this, as a consumer, what is my responsibility? Because as you say, it's unregulated. You can read and you can Google as much as possible. But at the end of the day, as you say, there's no actual standard as of yet. What is my responsibility as a consumer?
Yeah, I think you can only talk about responsibility if you have knowledge. So, and I think that's the first step, because you cannot make decisions if you don't know what to do. And I think that's a crucial point in time in our ecosystem at this moment, that we first have to make sure that not only consumers have the knowledge, that there are biomarkers of aging around, you can test yourself, that lifestyle choices are already proven to reduce that biological age. But also it's not only the consumers, but also politicians who are writing guidelines and making decisions. They need to be educated that there's a new field popping up. So first the education, and then you can talk about shared decision making. In my view, being educated, I think it's a responsibility of that individual to a certain amount.
Yeah.
But then ethical questions also comes in. I talked about this nice book of genes we have. Some are fortunate to have good genes, some are unfortunate. And there I think the ethical question kicks in. Okay, what is the responsibility with what kind of genome phenotype you are born with in a certain environment, how much responsibility you can take. But for sure, many individuals can take much more
onus of their health.
Absolutely.
It's wonderful to have you here at Abu Dhabi
Thank you.
Global Healthcare Week. Thanks so much for talking to us.
Thank you.